Hey Nurse Awesome, I'm going to talk to you a little bit today about how you can get information from this big fat textbook into your brain in a manner that's really super efficient and effective. And that's really what we're going for, because we have tons of stuff to do in nursing school and not near enough time to do it all. So first things first, don't spend time rereading chapters and rewriting information that you read. It's just not the most effective use of your time. It's going to take a long time for you to get data into your noggin that way. Second thing, these little flashcards, remember, are super duper useful when it comes to pharmacology or lab values. No bueno when it comes to trying to memorize disease states. Memorization is not the way to go. You've got to create a ton of links. You've got to act like a CSI investigator, you know? So here's what I would do. I would look at my chapter, and as I was reading, I would ask myself these questions. What is this disease? Why is this happening? What is it that happens that makes the disease happen inside the body? What makes it worse? What makes it better? What is my doctor going to do about it? And what am I going to do to support the doctor? What is it that I'm really super worried about that might happen to my patient while they have this particular disease? And what am I going to do to fix that for my patient if I can, right? So what I found was that I would start to read a 20 or 30 page chapter, and that by the time I was finished with it, I would have maybe 1 or 2 pages of information with those key points and lots of little arrows and boxes and colors that kind of connected all of those dots in a way that was meaningful for me. My neighbor probably could not even understand my hieroglyphics. It really was effective for me. So let me show you what I'm talking about, and you guys can use this as a jumping off point to create your own study technique. Okay, so we're going to look at CHF. That's a pretty popular disease process. You're going to see it a lot in the hospital. What you're not going to see is to walk into a CHF person's room and them to stand up and tell you, "Hi, my name's Melissa. I have CHF, and the doctor has prescribed me Lasix. That Lasix is going to cause me to lose fluid, which will help my heart pump more efficiently. However, it's also going to make me have orthostatic hypotension, which is going to make me fall down and go boom." That's not going to happen. So creating links from the information that you've read from that humongo textbook is what's going to help you help your patient. Here's what I mean. So CHF, that's a disease that is about, your bad pump. Your heart is a bad pump. Bad pump equals more fluid. That's a real down and dirty way to say, without your heart pumping efficiently, you're going to retain fluid, right? So then the one treatment that I chose to focus on was Lasix. And what the doctor is going to do is probably going to be more than just Lasix. However, this, is just a real quick version. I wanted to focus on one thing. Lasix helps remove fluid excess, right? It also is going to make potassium go away, because we know that you lose potassium when you diurese, and that's what Lasix job is. So if I'm going to be giving Lasix, I better be checking potassium in my lab review every day, more than once, and it better be 3.5 to 4.5, right? I also, if I'm giving Lasix, I better teach my patient to stand up slowly. Patient safety first, please, because of this orthostatic hypotension. I also better be measuring my eyes and nose, because this is how I'm going to know if Lasix is doing its job too well or not well enough. Checking weights is one of the things I'm going to teach my patients to do at home, right? I'm also going to know that Lasix causes ototoxicity. That's one of those bad side effects. I don't want that to happen to my patient. So I'm going to teach them the side effect of ringing in the ears. And if your ears start ringing, you need to let me know really quick so we can do something about that. The other thing Lasix can cause is dehydration in your patient. That means I'm going to be checking the skin turgor for my patient a lot, because if I don't do that, they could become dehydrated and I wouldn't really know, right? Okay, so you can see that's a really easy way that just breaks this down in a way that connects CHF to the treatment and the symptoms and what I'm going to do about it to the actual treatment itself, right? And over here, well, too much fluid, that means that I'm going to get pulmonary edema, and that's the worst case scenario for my patient, right? So I'm going to make some videos that go into some specific disease processes that you guys asked me about in email that draw out these little care map kind of creations. shoot me an email if you want to see something different than that. I'm happy to do it for you. Otherwise, I know you're going to take this information and use it to study in a way that's really effective and efficient and makes you even more nurse awesome. Till next time, you guys. Peace.